most husbands too should also support their wives. If your baby needs oxygen, delivery, it will be done. Sometimes they just need the warmth. The mothers need to also trust the nurses in there that yes, they are doing the right thing.
Yeah.
Yes.
Welcome to Tiny Tales, where we explore the unique experience that giving birth is to every woman.
We will hear the personal tales of women in Ghana who will take us on their journeys
to motherhood, from conception to birth, to the first 3 months after the baby is born.
This season is sponsored and co-hosted by Gaia Organic,
your plug for fresh, healthy organic food in Jawulu, Accra. Hi, my name is Lisa. I'll be your host. Today I'm talking to Stephanie, a nurse at the PICO who deals with babies from 0 up to several years. Today we'll be focusing on preemies, so babies who are born before term. Welcome, Stephanie.
Thank you.
Thank you for coming and taking time out of your schedule to join us.
Welcome.
I wanted to start by maybe you can give the viewers one piece of advice. So imagine a lady who's just been told she's pregnant, she's just been told she's going to have to give birth prematurely. Mm-hmm. And I'm sure she's worried at this point. What is the one thing you want to tell this woman?
If you're out there and you've been told this, I guess you are more than 20 weeks pregnant and less than 37 weeks. So just trust your doctor. Your doctor knows what he or she has seen for him to give you this advice, because it's better to take the baby out than have future complications. We've had successes of premature babies getting well. Trust me, 1 year later, I can tell you 6 months later, you'll be laughing, you'll be celebrating. So relax, trust your doctors. Everything is going to be fine. You are not the first person and you won't be the last. There's always success. And every mother or every pregnancy is different. So don't be scared. Don't listen to what people are saying. Trust your doctors and trust God as well.
What do you think is going through the heads of a woman, or the head of a woman who's just been told she's giving birth early?
I guess she may be thinking that I may lose my baby, or I may even die. Like the mother may, yes. But and a whole lot. Maybe they may also think that they'll be giving birth to children, babies with congenital abnormalities. We've had hundreds, thousands of successes with premature babies. Even at 34 weeks, you're like, this is bad, this is bad. But doctors and a good hospital know what they are doing. You just have to check if the hospital, definitely if you are being diagnosed at a clinic or something, they'll refer you to a teaching hospital or a bigger hospital, I should say, where they have the incubators to really house the babies. And these incubators are set to a temperature that the babies need. The babies feel like they're in the womb. It works the magic. So no need to fret, no need to be scared. Husbands, support your wives. And let them go through this successful.
And the doctors might at this point also say, for the baby and for the mom to be safe, you need to have a C-section. And what would you advise parents, soon-to-be parents who are nervous about that?
7% of mothers or pregnant women are scared of C-sections, but trust me, whether you deliver spontaneously or through C-section, it's still the same, and both are the best, depending on what the doctor sees. Maybe you may be having eclampsia, maybe your BP's just shot up and all that. There are certain conditions that when your doctor sees in your pregnancy, they would advise, no, I don't want you to deliver through the vagina. This is what I want you to do. And you should trust them. And I believe that most husbands too should also support their wives when it comes to this stage, because they need to give their support. If there's any consent form to be signed, just do it for the safety of your wife and your baby, your incoming baby, because that period can just tell it can determine whether you have a baby home or you just have your wife alone, or sometimes you may lose both. With that delay, you can be in the labor room and something just happens and they can't go on with the spontaneous delivery. So it's an emergency.
Yeah.
So you just have to, let's do
go
this.
for it. Yeah.
Yeah.
Yeah. Again, it's the same advice you said before. Trust that the
Yeah.
doctor's
Trust,
telling you
yes,
the right thing.
yes,
Yeah.
yes.
And that
Because
a
I've had-
C-section is not, I guess a C-section is not ever the first choice. The
No,
first choice will always be
the
spontaneous or
yes.
vaginal
And
birth.
interestingly, you know, there are people who also would book with their doctors that I want C-sections.
Yeah.
And it's fine. Both has its complications, both has advantages and disadvantages, you know.
Yeah.
Because personally, I wished than CS.
Why did you want to have CS? Because I personally also I agree with you. When at least I was thinking, CS would be nice because you can plan it.
Exactly. So
Like
I
you know
had
the
a whole
day.
lot in mind. I'm like, I felt like, okay, those who have CS, you don't have this weight down there, but those who did it will also tell you that they wish they had done.
So then now we're so imagine the mom has given birth now, and then the baby goes directly to the NICU.
Yeah.
And what happens there? Because in the NICU, the mom can't come. Like she can't stay with her baby all night. So she's, and it's heart-wrenching. I mean, it's heart-wrenching. You just gave birth, and finally this little human that you've been baking for 9 months is out, or however long it's been now, and then you're told you can't stay with the baby. It must be hard. What happens in it? How do you reassure the moms out there who's had a baby in NICU? How do you reassure that everything is going to be fine? We're taking good care.
Yeah.
So what happens in there?
One thing I know is that in the NICU, so the NICU is the Neonatal Intensive Care Unit, so an ICU, and whenever you are in an ICU, like the first thing that comes to mind is infection prevention. Like you are preventing any list of infections from affecting the premature baby. So in the NICU, we have incubators where we put the babies in, and we have qualified staff, nurses. Trust me, they are doing well. They are doing very, very well. They are doing very well. If your baby needs oxygen delivery, it will be done. Sometimes they just need the warmth
Of the incubator.
and then the medications and the reason why you don't keep a mother beside, it's what I mentioned earlier, infection prevention. We are preventing because some of their organs are not well formed, so they are susceptible to every infection. The mothers need to also trust the nurses in there that yes, they are doing the right thing. Yes. And sometimes to those who pull through, there's something we call kangaroo mother care. You know how kangaroos are, how
In
they
the pouch.
they keep their babies in there.
Yeah.
So we have a cloth,
Uh-huh.
then we tie it, then you put, like, there's a way you put your baby in. So
on your chest.
yes, inside your breast.
Okay.
You see, there's this
Warmth.
exactly.
Okay.
And this thing, sometimes when you are being discharged, the nurses will educate you on that. You can do it, your husband can do it. It's a shared responsibility thing. When you go home too, everyone is excited that you've delivered, they want to come around, but premature babies do not have, like, you cannot put them at risk for such things. And I believe that your family members, your friends would understand you.
So that's one thing you tell parents who are taking home a preemie is to limit the interaction with too many
visitors. We are in Ghana.
Yeah, the family wants to come by, and the family is big.
Yes. You need to do that to protect your baby.
And how long do they have to do this for, the parents? When can they start opening up for visitors, like mini visitors?
So for a term baby, Ghanaian culture, we say after a week, you there's this outdooring, then they do the naming ceremony and all that. But for preterm babies, I think they need more time.
They need more
They
time.
need
Yeah.
more time because some preterm babies can even be in the hospital for as long as sometimes 2 months, 3 months. You get it then. So by God's grace, if you're able to take your baby home earlier, you still need to continue the infection prevention precautions that you were told.
Yeah.
You cannot
So what
risk
would you
that.
tell a parents who just took the baby home? They're
Mm.
probably worried. I mean, even with the term baby, when I
Yeah,
took my baby home, I
yeah.
was like, oh, now I have to take care of her, and I don't know what to do. I don't have a driver's license and taking care of babies, so how am I supposed to figure this out? And then with a preterm, especially because a preterm baby has just gone through the NICU, so he or she has just he's fragile or in a different way, sensitive in a different way than term babies are also,
Yeah,
fragile in some ways,
fragile.
but these are just a little bit more. So I imagine the anxiety level is
Yeah,
probably high for
yeah.
new parents taking a NICU home, a premature baby home. So, well, what do you advise them to do besides from now we
Yeah.
know not too many visitors, but is there anything else that you tell them to make sure that they feel comfortable?
Yeah. I want you to see your baby as a normal. Preterm doesn't mean your baby is abnormal. It's a normal baby. So you treat your baby just as
Any other baby?
any other baby.
Okay.
I've had the experience where mothers are scared of the babies because they look very small.
Yeah.
Don't be scared. They're just a baby with a low weight. And one thing, the warmth. So if you are not doing the kangaroo mother care, sometimes you the mother with the kangaroo mother care, it makes you feel good psychologically because you feel your baby. That's where your baby feel your heartbeat,
Yes.
the warmth. So and they do well. They do well. The baby came out prematurely, and wherever he or she came from, there is a level of temperature there. So if
Yeah.
you brought the baby out, then you should still keep or maintain a similar temperature, which is the
Yeah.
warmth.
Sometimes read about people who like, it could be a 9-month-old baby, and then they say, oh, but actually the baby is actually supposed to be 12 months, but was born so much. So they keep it up for a long time. Like that
Just put
thing.
that away. Your baby is a normal baby. In future, you won't even remember, or you look back and you'll be thankful. You'll be grateful that wow, this baby, you've been through a lot, blah blah blah. Today, he or she is playing around, jumping, and all that.
Said that. What about when the baby's no longer a baby, but like a 5-year-old child? Is that 5-year-old child exactly like any other 5-year-old child?
Yes, if there were no complications from like the treatments that were given, so preterm baby comes out, medications are being given, organs are being formed, everything goes on well. The most important thing is the first, I say first 3 days of life, where you need to check some of the organs, like some medications need to be given and all that. So
Yeah.
after that, the baby is like every other, every other baby.
I think the message I'm taking away from this is really that if you've been told that you're going to have to give birth early, and also when you in general when you know you're having a preterm baby, is first of all trust your doctors.
Yeah.
Vaginal or C-section, both are fine.
Yeah.
And that in the NICU they know what they're doing.
Yeah,
So we need to trust
they
that our
know.
professionals know what they're doing.
Yeah.
And then when they come home, I think that's a really important lesson, that to treat them like a normal baby, because otherwise there's also a way that sometimes we can put, as parents in general, we can put fears into the heads of our children or ideas into their heads, and if we treat these babies or kids as something that is not within the normal range because they came a bit early, then maybe we're actually doing a bit of damage there.
And I think
if we're too sensitive,
you wouldn't want to tell your child that you're premature.
No, probably not.
Yeah, unless maybe they are grown to understand what it is and something that wouldn't affect them. Sometimes, yes, you will look at your baby. So you can just put the baby on their palm.
Wow.
This is small.
Yeah.
So mothers are scared.
Yeah.
to even touch. Some of these things leads some mothers into depression, to stay away from the babies, like
Okay.
postpartum
Yes.
depression.
Yeah.
And some people also blame themselves for having premature baby. You don't have to blame yourself. Every pregnancy is different. Every woman is different. So whatever happened to A might not happen to you. Whatever happened to you might not work for the other person. So trust the doctors, as I said earlier. We have risk factors, but the main cause is unknown.
Yeah.
And I encourage husbands and families to support such mothers when they are going through this moment, because that's when they need a family support. Because there are certain houses where when you have a premature baby, they see you to be maybe cursed. They think you did something wrong. Nobody did anything wrong. It's just what had to happen has happened.
Yeah.
You
Yeah.
get me? Sometimes to stress, so much stress.
Yeah.
So imagine someone in that situation having the support of the family, support of the husband. When they feel bad, when they feel they did something wrong, you tell them, you did nothing wrong. It's just normal. The baby will be fine. We
Yeah.
are all happy. So that mother can also, it helps the breast milk to also, like the formation of the milk, it helps it, because all this stress can prevent it from coming.
That's what I learned through many of these stories is really everything is like connecting with your body and
Yeah.
not being stressed. And that is, of course, it's a skill we all have to learn. It's a life learned skill, but it's definitely important, especially
Yeah.
while pregnant.
Yeah.
And preemies are born every day all over the world
All over the
to
world.
all kinds of people. And
Wow.
one child can be a preemie, the next one could be a full term. Like there is no
Yeah.
there's no order, there's no pattern. It's random.
Yeah. And
Yeah.
both babies are normal.
And both baby and both kids intelligent. Like there's nothing
Yeah.
to worry about. Yeah, exactly.
It's not like you are a preemie, so when you're at school, you be the last.
Yeah, no, no, no. It's not.
It's
Yeah,
not like that.
it's not like that.
So,
Yeah, yeah. Thank you very much, Stephanie, for enlightening us on this topic. I think it's very important because I think it's something that all of us who are pregnant, we obviously want a full term baby. So when we're told it's going to be a preemie, fears start happening in our mind. So I'm happy that you were able to shed light on that and help us to stay calm. Yeah.
Thank you.
And thank you to everybody who's watching. And I'm sure there are parts of, if you're out there and you've been told that you're having a preemie, please listen to what Stephanie has been saying to calm down, to tell your family, to support you, and to not stress, and to know that you haven't done anything wrong.
Yeah.
You're fine. Your baby will be fine. Take your rest. Listen to what your doctors are saying. That's the advice from here. Thank you. Thank you, Stephanie. And thank you to all of you who are watching. This show is supported and created by Tiny Reusers. Thank you.
Yay. Thank you.